more efficient, but it's up to you. So David, Ryan, over to you. Thank you very much for being with us tonight.
Sure. Thanks for inviting us. We appreciate it. So we're going to talk a little bit about soccer injury prevention and recovery. And I met Tim a few months back, and he gave me a call a couple weeks ago, and we put this together pretty quickly for you. So hopefully it'll go well, and we won't have any webinar issues. But welcome. I'm Dave Farrah, for those of you that don't know, and my sidekick, colleague, coworker, Ryan. I'm a PT and an athletic trainer. I graduated from Marietta College with a BS in sports medicine in 1990, and then went on and got my PT degree at Widener University. And I've been working here at David PT since 2001, so a little over 20 years.
So, and I'm Ryan Elsass. I've already introduced myself to quite a few of you already prior to this. So, but I've been a PTA since, it's a physical therapist assistant since 2008. And I graduated in 2011 from Mount Union in Ohio with exercise science, and since then been a certified strength and conditioning specialist, and been here since 2013. Also of note, we have a coworker named Hannah Zangara. She has played
club soccer
for
Beadling.
For Beadling
back in the day.
And so she offered some contributions to this presentation.
So in putting together the town hall, we sort of have a little itinerary here. We did a little research, background information, looking at periodicals and journal articles. And obviously, the growth of the sport is unbelievable over the last 30 years. Go to the next slide. As you see the slide here, it is the people's game. If you read that little blurb there, percentage of people who say they are very interested or interested in soccer, you know, it blows every other sport away. So it is the fastest growing sport in the U.S. I looked at some of the things that I found interesting for girls, 35-fold increase since the 70s, and for boys, about a 5-fold increase. Obviously, it's enjoyed by all ages, involves agility, aerobic, conditioning, balance, coordination, and teamwork. And I think the teamwork aspect is why a lot of people like to participate, you know, as we age and maybe get into some of the senior leagues. That camaraderie is what people strive for, and some exercise. And then, you know, Western Pennsylvania being a hotbed for football, a lot of parents that I'm friends with, our kids never played football, and you can see that as about a 20% injury rate of football. So I think a lot of people have moved towards soccer and away from the collision sports of football. And if we move to the next slide, we'll talk about injury rates. These are some of the things that sort of jumped out at me when doing a little background. I was trying to look at like the most common injuries in soccer, because if you know those injuries, that's how you sort of prepare to prevent them. So just running down that list, per 1,000 hours of exposure, there's an injury rate of somewhere between 2 and 20. The adolescents have a higher injury rate than the youth, 12 and under. In competition, it's 4 times higher injury rate than practice. And then player-to-player contact was the most common mechanism of injury during competition. So
on a fun note, that's the only way I broke my leg in soccer in high school, was a broken fibula bone on the outside of my leg. Everything else was fine. Didn't get hurt in any other scenarios until someone decided to slide right into my leg. So, but that is, you know, at least
contact. Player-to-player. And then non-contact is the greatest injury during practice. And then girls have a higher injury rate than boys. And we have some slides that we're going to talk about the reasons for that. That's some interesting research that's going on. 45% of the injuries result in missing less than a week. Most common injuries that cause long-term time off are concussions, which is, we're not really going to talk about concussions tonight. That's a whole nother topic of discussion. Knee sprains, ankle sprains. And as we run down the list there, 89% were new rather than recurrent. 60% are to the lower extremities. The hamstring is the number one muscle that is injured in soccer. And most re-injuries occur in that first 2 weeks after return to play, and are typically more severe. And that's sort of where this prevention comes in. If that's the research, then kids are probably returning to sport a little too soon. So they're being mismanaged. So we'll talk about that later on as well. So let's move down. What is this here? Oh, this is moving on to like the high school ACL injury rates per 1,000 athletic exposures. Girls soccer is number one. So you see it 11.7 per 1,000 hours of athletic exposure. I'm sorry, not 1,000 hours, per 100,000 athletic exposures. So if you think about that, and I'm going to ask a question, how many girls do you think in season play soccer or participate in a soccer practice or soccer game on any given day?
Yeah, what have you guys seen? Is that a
you think that's
pretty accurate assessment?
I couldn't really tell because I don't have numbers, but I know that from my experience when thinking back as a coach, girls were more prone to injuries compared to boys.
Yeah, and we'll get into that a little bit because.
But I think the significance of that is like on any given day, I would assume there's 100,000 girls playing soccer in the United States, either practice or game. So, it's almost like every day there's going to be 11 to 12 torn ACLs. So, prevention is key in trying to drop that number. And second is boys football, which is a collision sport. So, there's going to be, you would expect to see a little bit more injuries with the collision sports, but girls soccer is number one. And then I think we missed one. Yeah, there we go. And then this is the collegiate ACL injury rate. Again, if we look down, it's third in college. So that's per 1,000 athletic exposures, so 0.28. Women's gymnastics and men's spring football are only higher. There's a higher incident of women's injuries, and how do we prevent those? So
yeah, I mean, if you look in the top 5 or 6, I mean, the women's sports are the top
injury rate,
injury rates for ACLs.
So
why is that?
Yeah, why is that? So girls compared to boys. So the higher injury rates equate to 3.3 to 2.5 for 1,000 athletic exposures. ACLs are significantly more in girls than boys. And the factors that contribute to this, basically lower extremity anatomy. The women and girls have just a slightly wider pelvic structure than boys, which creates an angle on the knee and just predisposes that knee to move inward and maybe rotate inward a little bit. And we have a couple pictures later on. Also, there's a body of research going on now. There are hormonal influences associated with the menstrual cycle that sometimes put them a little bit more at risk, depending on the hormones and the time of the month. And then neuromuscular activation patterns. It's been shown that hamstrings in girls don't fire as quickly as they do in boys, and that's just probably a genetic thing that it's going to be hard to fix.
I mean, and that's just like a millisecond off.
Right.
So what can happen is when you land, the hamstrings kick on to pull the tibia back to make sure it doesn't translate forward. When it translates forward too quickly, then it puts that stress on the ACL. And, I mean, it's just, as Dave was saying, just one of the factors that contribute to it. But it's also something that can be trained.
Right. The season-ending injuries are higher for girls than boys. But, looking through all the research and literature, you guys have a very, very good program. That FIFA 11 program is a very valuable tool. I looked through and it talks about landing and exercises, and that is, and the research is there to prove that it works. So I would definitely consider looking at that if you haven't done so and implementing some of those drills in the off season and probably during the season as well.
So, and these are things that affect performance that can easily be modified. Muscle imbalances, which we will get to next with between the quads and the hamstrings. Leg dominance. A real easy trick to tell how your leg dominant is have someone give you a little tap from behind, and whichever leg steps forward, that's the leg you're dominant for. You got to get your sleep. I mean, you got to condition properly. I mean, you can't just not do soccer all summer and then hop into the fall and expect to be where someone who has been training is. So
yeah, these risk factors are basically things that we can control, or the player can control. So when you're working with the athletes, these are things you got to look for. Some of them may not be as obvious, but there are some that are very obvious.
Yeah.
So types of injuries that we see that we're going to try and prevent. Overuse injuries are very preventable. Sprains are preventable to a certain degree. Strains are definitely preventable. Obviously, fractures are tough to prevent. Dislocations, separations are tough to prevent. And then concussion and facial and eye injuries are also difficult to prevent. Unless you're teaching good jumping techniques when you go in for headers and things like that. So if we're looking at overuse injuries, the four there that I put down are tendonitis, shin splints, stress fractures or stress reactions, then apophysitis. Obviously, tendonitis that we see here in the clinic deal with mostly Achilles and patellar tendonitis, and that comes from just overtraining. It's just too much tissue stress when it's not ready for it. So the conditioning in the off-season programs are vital for that. Shin splints involve the anterior and posterior tibial tendon, which is in the lower leg. I don't know if you've ever had shin splints. They're very painful. They're very debilitating, and they can lead to stress fracture or stress reaction, which is actually a fracture or an irritation of the bone where those muscles attach. The apophysitis injuries like Osgood-Schlatter's and severe Sever's disease, those are both basically in areas of the growth plate and occur sometimes due to overtraining, but a lot of times kids are growing so fast, the bones are lengthening, the tissues, the soft tissues, the muscle, the tendon cannot keep up, and that's where stretching is super important to try and keep these muscles in length with the bone as it grows. From 12 to 15, some kids are going to grow 6 inches, and that's a very difficult time frame. That's when we see most of these Osgood-Schlatter and Sever's issues. So just to differentiate the sprain versus the strain, a sprain involves a ligament like the ACL or the ligaments of the ankle. Ligaments provide stability at the joint. When they are stretched beyond their capable means, can lead to grade 1, grade 2, or grade 3, which is a rupture. Very similar with the strain, that involves muscles and tendons. Tendons connect muscles to bone, and they provide that dynamic stability. So when you are running or cutting, the muscles are basically keeping those joints stable. If you get to the end ranges of those joint stability, that's when the ligaments will kick in. So a quick example of like an ankle sprain here, the ligaments on the outer portion, right where Ryan is moving the cursor there. Those are the ligaments that are typically sprained.
Especially during this one.
Yeah, with that inversion motion. And, I've seen that when kids are sliding and their cleats dig into the surface and they roll their ankle, or they're making a hard cut. And sometimes, there's maybe like a clump of grass, or it's not super smooth and they hit that and they roll it, or just maybe a little bit of weakness or just pure bad luck. You just roll it because you landed on someone's foot or something like that.
Mm-hmm.
And then here's just a diagram of the knee, and the ACL is the one in the middle there. So that provides stability for translation, like Ryan was talking about earlier. If I had a knee joint, I'll do it from the side. So moving forward, I'm sorry, the tibia moving forward on the femur. I don't know if you can see, my hands aren't really, so here, this slide shows a little bit better. When you have a valgus stress, so a valgus stress is a push from the outside of the knee and it opens up the inside. You see those little arrows pointing to the medial collateral ligament. That prevents that, but then the ACL is more for the shear and rotational forces. But if we go back to that previous slide, you can see the picture on the right side of the screen. Those are valgus angles of both knees. They're sort of pointing inward. The toes are pointing outward. That's the position you're going to see mostly with ACL sprains.
And I don't know if you can tell, but like if this was a female soccer player and the ligaments are already prone to being overstretched at certain times, and the hips are wider, and then it provides that angle's called a Q angle. The wider the angle is, the more potential injury that you will have for the knee when you are doing these sports, especially non-contact injuries, because her knee is starting to shift inward towards the midline of the body. And this is, I mean, we went over it, but this is also paired with a rotational component, which can also get the meniscus hamstring strain.
Yeah, so we had the sprains, now we're covering strains, talked about the hamstring being the most involved muscle injury in soccer. There are different grades. Grade 1 is a mild strain, which will probably put you out for, about a week. Grade 2, there's some tearing of the muscle fiber, so that could be, depending on how much muscle fiber is torn, could be up to 4 to 6 weeks. And then that grade 3 strain is a rupture, basically, and you're going to be out for an indefinite amount of time. So, all right, so how do we prevent injuries? So we talk about flexibility. Some people are just inherently more flexible than others. So there are two types of basic flexibility. One we call static and one is dynamic. The static flexibility exercises involve the long holds, where you put your foot up on a stool and you lean forward to stretch your hamstring, or you lean into a wall and put your foot behind you to stretch your calf. The advantages of the static stretching, they're great for the off season. You're going to get true muscle fiber lengthening. The muscle fibers are made up of a thing called a sarcomere, and you're going to add sarcomeres the more you stretch. So they're great in the off season. They're great on the off day. They're great after practice, and they're great for true lengthening. So the hold time should be about 30 seconds, and you do about 5 repetitions, and it should be done daily. But the disadvantages, they reduce power and strength for up to 30 minutes after they're done. So I don't know why we would do these types of stretches prior to participation in soccer or any sport for that matter. The injury rate can be up to about 30% higher versus dynamic stretching. And the effects of static stretching are sort of short term, just basically due to the neuromuscular component involved. Like if you reach down to touch your toes, you put a little stretch on the tissue, and then you stand back up and then you reach down again and you say, oh, I might go a little further, but there's really no lengthening of the tissue. It's just the nervous tissue, or the neurons are more adaptable to the change in length there.
So then what has caused the shift? So before I started, when I was in high school, we did a lot of static stretching and then a lot of kind of like field drills before we started a game. But since then, we started doing more dynamic stretches. And it's partly due to the thixotropic effect. So what that means is when you're just sitting there for a long time, your muscles just have this, I don't want to say gel-like state of rest, but you get really stiff. But when you start moving around, then things become a little bit more liquid and you start to be more movable. You get warmed up, you increase the tissue temperature, your coordination improves. It's a lot like when you open up a yogurt container and the yogurt is just kind of sitting there, kind of like jelly, and then you kind of mix it around with your spoon and it becomes liquid. That's kind of what is happening when you are when you're warming up. Not calling your muscles yogurt or anything like that, but you're giving it a better chance to get ready for the sport. And that's what all of these are going to be. All these exercises in the next couple of slides are going to be showing. Some disadvantages of this dynamic is teaching the movements can be a little bit complicated depending on the age range that you have, especially in like the youth groups. And there is no real lengthening of the tissue. You're just getting used to the tissue lengthening. So here are a couple of static stretches for the calf and Achilles. So the one on the left, he's stretching the big gastrocnemius muscle, the one that you see when people do heel raises. The one on the right, he's stretching the soleus muscle, the one that lays right underneath of it. And not only is the soleus important for just endurance, I mean, you're standing all day using that muscle. That is also a muscle that is used constantly in running, which you do a lot of in soccer. As earlier stated, typical holds are 5 times, about 30 seconds apiece. So, any questions so far with the stretches or getting into the dynamic warm-up stuff? Okay. All right, the next one is the quads. It's a group of 4 muscles in the front part of the thigh. How he is stretching it is he's just standing up tall and bending his knee up toward him. Now, I know a lot of people like to reach back with the other hand, but you're going to also put like a little twisting shear force on the knee while you're doing that. And another way that this could be done improperly is, see, he's doing a good job by keeping his knee flush with his other leg. If he let his leg go forward, then he wouldn't be stretching the quad quite as much.
So this is a picture of my son, and he has tight quads. You can see by how his angle of his upper body, and then this angle here with his thigh. So he's leaning forward a little bit. I'd like to see him standing up a little taller and have that knee in line with the other leg, but he's doing a good job of keeping it in line here. It's not bowing out. When you have tightness, this leg will angle out. Can you see that cursor moving out that way? That's not the correct way to do the stretch. He's doing the stretch correct. He's just tight. And then we have the groin stretch, and he's pretty flexible that way. And then the hamstring stretch, he's doing the way we teach it. A lot of people teach that stretch to be done with your head going down towards your knee. That head going down towards your knee is basically stretching your back. It's not stretching the hamstring. You want to keep yourself upright, and you want to lean outward towards your toe, or even, you can reach out forward even more because the stretch occurs at the pelvis as opposed to your back. So that's how you want to stretch your hamstring.
Okay. So how the warm-up should go is you do like an initial jog, either up and down the field, a couple times to the to midfield, or if there's a track, just a nice slow jog for about 5 minutes. And then we can get into dynamic stretches, dynamic flexibility, and then some other dynamic movements that you can use that are more running to the 18-yard box and back. So the thought with it is that you can do these for about, I don't how long does a typical warm-up usually last? Like before a game, how long do you guys have?
Usually about 15 minutes.
About 15 minutes. Okay, these can all be shortened, or any, I would imagine that doing the actual passing and kicking drills is very important right before the game. So this is just going to help get you moving before that. Okay. So you can always change up the numbers here in regards to these exercises, but this one right here is for spinal flexion and extension. So what you're trying to get here is when you're going backwards, when you're going forwards, you want the hips outside of the back side of the ankles. And then when you're going backwards, I used the wrong transition there. You want the back part of your shoulder blades back over your ankles, and then when you go forwards, like I said, you want to have your hips back past your ankles. So that's going to give you a lot more bend in your back from front to backwards. This right here is called multi-segmental rotation. I'm twisting every part of my back from the lumbar spine to the thoracic spine to up to my neck. Also, my hips are involved too, because there's a lot of multi-directional movements that are involved in a soccer game. You want your body to be prepared for that. Side bending. Just try to make a nice big C shape there. This one right here is for the hips. You open it up, and it's also dynamic for your other leg because you're challenging its balance. You're challenging the balance of the other leg when you're standing on it. This one I think is the most important one. If you guys can't get anything else in, then the rotational sling stretch is the one to do. So when you're lunging backwards, you have your, say this for me right here, it's my right leg, and I am twisting away from that side. You're made of way more than just muscle. You're made of this connective tissue that goes up and down your whole body. When I'm twisting away from that leg, you're stretching from my fingertips all the way down past my knee. You're getting that whole rotational sling, because then when you kick, that is the motion that you're doing. You're moving in a rotation as you're kicking through the ball forwards. And it's just a couple times each way. All right, so this is one that you can actually do while you're walking, but for younger kids, getting down into the low lunge position while you're getting into like those thoracic rotations is a great warm-up for soccer. This one right here, you're stepping forward and then you're stepping at a 45-degree angle while rotating over that leg. Again, because soccer is such a multi-directional sport, you really need to get forwards, sideways, backwards. These are for dynamic hamstrings. Because I mean, it's not quite the soccer kicking motion, but your hamstrings are being pulled as if it typically is. Now, this one is a little less coordinated than the other ones, but you go forward, you move your hip in, you go backwards, you move your hip out. You want to get the hip opening back and forth. Dynamic hip flexor stretch. This is Dave doing the dynamic hip stretch. We just walk forward, pull the knee up towards your chest. That'll help stretch the backside of your hip out. And then there's some more dynamic hamstrings. So as he's
really tight.
As you can see, he's a little tight, but he's also not reaching for his leg. And then the last one here is the dynamic hip adduction stretch. Moving back and forth, he's stretching through a range of motion, an active range of motion. Oh, wrong way. And then these ones, I think you could knock them out about to the 18-yard box or just to the penalty kick line, where you could do high knees, butt kicks, sideways, karaoke, backwards jogs, and then stand at the goal post and stand at the goal and just swing your legs forwards and backwards and then side to side. Do you have any questions on these exercises right here? Or the previous ones? I know we just kind of went through them.
You run it. Oh, what, a minute, half a minute?
Yeah. So I just discovered iMovie. So I was going to overlay it with a lot of cool songs, but I decided it'd be too much.
Okay, so now that's more the static stretching and the dynamic stretching, and now we'll move on to strengthening. So there's core and lower extremity strengthening exercises that we teach here in the clinic and should be taught outside of the clinic to all athletes for that matter. Core, we talk about planks, which are prone, side planks, and a combo of the two. I'm sure everybody knows what a plank is. Modified sit-ups, that's we don't do really full length sit-ups where you're coming at your back coming off the ground up where your shoulders getting close to your knees, because basically you're working your hip flexors after the first 35-40 degrees of motion. So a modified sit-up is like a crunch where you're just clearing your shoulders and your head. There are bird dogs, which are on your hands and knees.
If you have any questions, or if you want to see one, then we can, like, if you're not familiar with a bird dog or a dead bug, just unmute yourself and we could show you that.
Show you that. Right after we do all that, we can do it towards the end. That way we can move this computer. And push-ups, and then lower extremities. We have straight leg raises in all planes: forward, backward, inward, outward. Some bridging exercises, and there's lots of bridging exercises you can do. Single leg bridges with motions from that. Closed chain strengthening is like your squats, your leg press activities. And then we have some information on plyometrics and eccentrics. The eccentrics, there are a lot of studies on that. It is shown to prevent injuries to the hamstrings, the quads, and the hip adductors by up to 50%. So they're very difficult. Running in that list there, from straight leg raise down to bridging to the closed chain strengthening and even the plyometrics, you should be pretty well adapted with those before you start these eccentrics, because they are very difficult maneuvers. So it's a Nordic hamstring, a reverse Nordic quad, and then a Copenhagen plank, which we'll show in a little bit. But I think we're moving into plyos. Nope, there's the low extremity. Oh, so the basics here. So real quick, the middle of the left, it's called knee phase 1. Those are your straight leg raises where you're doing what's called flexion, abduction, extension, and adduction. And obviously here in the clinic, we do these with all our lower extremity patients. We start out with no weight. We work our way up to like 10 or 12 pounds, which is a good amount of weight to move for a straight leg raise. And then some of the other exercises it says, I guess, advanced phase 2. There's some hamstring and calf stretching, which we showed earlier, but the mini squats, there are step ups. Those are the closed chain strengthening, and then even the lunge in the lower right corner there. Those are things that should be done as you move in the progression. So plyometrics are not new. They're also known as jump training, in which the muscles exert maximum force in short intervals of time. And they're going to increase power, speed, and strength with these. Uses the stretch shortening cycle by quickly lengthening the tissue. That's the landing part. And then the exploding upward is the shortening movement, the eccentric and the concentric contraction. The examples of these are like box jumps. I'm sure you've seen those before. Squat jumps, burpees, tuck jumps, lateral bounds, just to name a few.
All right. And a special thing to note with plyometrics is that it's not something that, if it's your first day doing it, you shouldn't do a ton of it. If you had a program for plyometrics, it should really be done on a plyometrics day. And plyometrics are not aerobic, they're not cardio. So if you do a box jump, your goal isn't to really raise your heart rate. Like, you need to focus on what the task at hand is. So like a sample program would be if somebody is new to exercise or plyometrics in general, you want to do something about 50 touches a day. So if you have a line jump, when they jump over the line, that's 1 touch. When they come back, that's 2 touches. So, and then the more that you progress through your program, then you can change things by doing one-legged, by increasing your touches to 150 or 200. But it should really be its own day. So, and again, not aerobic.
And these are examples of the squat jump and box jump. So when the model here is landing, that's the eccentric contraction. So the muscle is lengthening to cushion the landing, and it's followed by a very quick and forceful, as you get good at 100% effort into the jump part of it. So it's a quick landing and a quick jump, and that is good for power and strength. And then we have the step jumps and the lateral bounds. Pay attention to that lateral bound there. That's sort of what we would teach with ACL injuries or prevention of those injuries. You can see how her knees are right over her ankles and right under her hips. There's no valgus stress. There's no rotational component to her knee. And I think in that FIFA 11, there's some good literature and exercise which really focus on that. So that's what you're trying to teach when you're doing these type of things. So if you're doing warm-ups, maybe during practice, you're doing a little bit of plyometric jumping, pay attention, especially to the girls or female athletes, that they're landing correctly. Now we're getting into the eccentric strengthening. So we had originally planned for us to demonstrate this, but it was so difficult that we decided to go to YouTube and find a few videos because our technique was extremely poor. So the Nordic hamstring curl is on the left. We'll play that for you. So he's lowering his body as slowly as he can. He's keeping his back straight for the most part. When I did this and Ryan was videoing me, my hips bent at about a 45-degree angle right off the bat, which just means my hamstrings are not capable of doing that maneuver. And you can see he lowered himself and then he pushed himself right back up, contracting the hamstrings in a concentric contraction on the way back up. And then the Copenhagen hip adductor will play now. You're doing it off a bench. Now, if you're at practice, maybe someone can hold the leg, the top leg, as you lift up and then lower down. And that's a very difficult exercise as well. Definitely not something a beginner is going to do. So that would be, to start on your way to the Copenhagen hip adductor eccentric strengthening. You would need to do a ton of straight leg raises with weight. And then, like this model's doing here, his knee is on the bench there. As you get stronger, it could be your ankle. You're just increasing that lever arm. Mm-hmm. And then the last one is, I'm going to turn the volume off on this.
It's already off.
Is the Nordic reverse curl. This is for your quads. A little easier. I could definitely do this one, but my hamstring and hip adductors, no way. It's just the lean back. Now, if you have knee issues, this might be a little tougher. So for the senior players, maybe this is not an appropriate thing to do on your off days when you're training, but maybe working up to it, you might need a good cushion underneath your knees.
Yeah, and the Nordic hamstring isn't something to be done every day. It's a very intense exercise on those,
right,
on the hamstrings.
I mean, when you start those Nordic hamstrings and those Copenhagen hip adductors, you're doing like 2 repetitions, 2 sets, and maybe that's 2 or 3 times a week. And as you get stronger, then those reps only need to be done 2 days a week, and maybe you're doing 10 to 12 repetitions. But it's a very difficult exercise.
Yeah, and they should all be worked into a balanced exercise program.
Right, but like we said before, the eccentric load is what is very good for preventing these injuries. If it's going to prevent injuries of hamstring, strains, hip adductor strains, quad strains by 50%, then they're worthwhile. You got to work towards those, especially, your elite athletes. Maybe not, I don't know how club level works. I'm sure there are elite leagues and, based on skill level. So, maybe your elite and very focused athletes should work into that stuff.
What's the appropriate age for these to start?
So then we're going to talk about recovery after participation, like right after a game or right after a practice. Obviously, hydration and refueling is vital importance. They should be hydrating during the game. Static stretching, like we mentioned earlier, is good right after a game. Muscles are warmed up, they're full of blood. It's a good time to cool down and get some static stretching. And then foam rolling, I've seen some soccer players after practice actually roll out on the ball. So that's another way to get some like almost like a massage on the muscle after it's been worked really hard. And foam rolling, it works on the fascia of the tissues. And there's so many different theories of why it works and why it feels good and it's beneficial. But there's no real concrete evidence on how it works. So we just know it works, but there's just no real good evidence of how or why it works. So, and we're talking about rehabilitation after injury. So this is where we come in, and the doctors come in, and the athletic trainers come in. Obviously, it depends on the severity of the injury. We see lots of ankle sprains, lots of patellar tendonitis, lots of hamstring strains throughout our year, depending on the sport that's going on. So as I said earlier, the minor grade 1 stuff isn't so bad, a couple of days to a week. The moderate grade 2 stuff, a little bit more involved, depending on, if it's an ACL grade 2 sprain, you're probably looking at, a good 6 weeks before they can return, because all those muscles that help control that knee motion need to be extremely strong, because you can't really depend on that ACL to do its job. And then, like I mentioned earlier, severe grade 3 sprains and strains, you got to be cleared by medical personnel to return to practice. Ankle 4 to 8 weeks, it's a bad ankle sprain would be 8 weeks or more. And then the ACL, we have ACLs in here all the time, and it's up to a year before they return. So that's pretty much it. I put this video in here because I just thought it was a great. Let me start it. And maybe you've seen this before. I just think this is a great way, before practice or after practice, they're getting a little jogging in and then they're doing some high kicks. And if you watch some of the kids in here, you can tell which ones have really good hamstrings. So as a coach, you're looking and saying, well, this kid may need a little bit more static stretching on the off day, a little bit more static stretching in the off season. But there's a lot of jogging going on. They're keeping their muscles warm. They're cutting. They have to pay attention to where they're going because there's kids everywhere. And that's good in soccer too, because you have to avoid contact sometimes. That peripheral vision needs to be used. So this is a really, I thought it was a great video just because of all the different things that are going on here. And then you're going to see, they're going to jump down to a squat here, and then number 10 gets a cramp and he has to go over and he has to stretch his calf out there. So, cramping is part of it too. And then he gets up and continues. I'm going to stop it again there. But I just thought that was really good. And you can look up top at soccercoachtv.com, post-game recovery stretching or session. So I thought that was a really good video of sort of what Ryan was trying to demonstrate earlier, did demonstrate earlier. So questions and answers. Does anybody have anything? One question I had was with the club soccer events, like are there medical personnel there for games, or like are there certified athletic trainers there? I would think like for tournaments they would have like a trainer on site for the multiple games that are going on, but for like single games on a weekend, are there medical personnel there covering events?
Typically, we do have athletic trainers at our tournaments. The games on the weekend with the clubs, typically there are not athletic trainers or medical personnel there.
Okay. I was just wondering, like, if there is an injury, what happens? I guess the coach has to take care of it, or the parents have to take care of it.
Yeah, and if it's really bad, obviously it's a trip to the emergency room or to Med Express or someplace like that.
That makes perfect sense. I was unsure if like each club had like a team doctor or a team athletic trainer that would cover events. When I was in PT school, I was already an athletic trainer, and I covered like soccer events and football events for a local high school that just needed some coverage on the weekend. I just didn't know if that's sort of the norm or not. But does anybody have any questions? Like, what do you guys see on the field? What are your most common injuries? Do you think we covered what you see for the most part? Is there anything special out there?
I was going to ask about the eccentric exercises. What do you think the minimum age there would be to start those?
Well,
Is
you
that
can you can
is that
start.
a teenage thing, or can they start younger?
They can start as teenagers. I mean, if you're because there's more eccentric hamstring exercises aside from the Nordic hamstring.
Those are pretty advanced exercises. I mean, even if you got on a leg curl machine and you were to, curl down with both legs, raise one leg up, and then the weight of the resistance would lift the other leg up. That's an eccentric contraction. That's a much easier way to control weight than your body weight. So those eccentric, the three that we showed you are for advanced, something you're going to work your way towards. But there are, I would start with those straight leg raises because there is an eccentric component. When you lift the leg up in the air, that's concentric. When you lower it slowly, that's the eccentric contraction.
And it's such an important thing for soccer players to have that eccentric hamstring ability, because when you're kicking, your leg is going through at such a quick speed that if your body doesn't eccentrically contract, then I mean, it's not actually going to happen, but your leg's not going to come off your body. But that's the reason that they eccentrically contract, is to slow you down.
Right. It's a safety mechanism. So your leg does not stretch too far. So that's why those muscles work eccentrically to hold that from being stretched too far. And that's how they have to be trained.
Yeah. But
we could show you exercise and videos all night on different eccentric work.
But I think you're good with teenagers. I'm not so sure if like 7, 8, 9-year-olds would be able to have the coordination to do some of them. So.
With my age group, I coach U11 to U14. And I'm also the commissioner for it, but I'm also rec, so it's a little different than the club people you're speaking with. Our biggest injury is not necessarily hamstrings, it's our quads, it's actually ankle injuries.
Yeah.
So I usually have at least 1 to 2 players a season that ends up with fractures.
Fractures?
Well, yeah, the fractures are going to be tough to prevent because they're getting put into an end range of motion. I assume are these occurring during practice or in games?
Games.
Yeah. So it's the competition is where you're going to see the increases by like 4-fold. So it's hard to prevent a fracture, but obviously agility work and balance work are critical in preventing ankle sprains. When we have kids come in with ankle sprain, we start some light range of motion right away and some light strengthening, but we get them onto the balance and coordination and proprioception stuff pretty quickly, because it's not putting the ankle in its end ranges of motion. You're working in like your mid zone and maybe 20 to 40% out of that mid zone. So it's not reaching end ranges, but that's how you're going to develop that balance. And balance work is simple. You just stand it on one leg. If Ryan wants to turn the camera to me, I'll sort of show you what we start with. If you want to see my leg. So,
There you go.
so just stand it on one leg and keeping your balance. And then from there, you can add some dynamic things where you're, yeah, they're not going to.
Sorry, I'm not doing such a great job here. There we go.
Got to go down.
Okay.
So maybe here. And then you would start working on that. This is more dynamic because you're in motion. And then you can get knee bends in, out to the side, knee bends forward, backward. This is all good balance and proprioception work. I'm way better at balance on my left leg than my right leg because I had so many high school basketball ankle sprains on my right leg. And then obviously back then we didn't do any rehab. We iced it, elevated it, wrapped it, and then, just try to get back into sport as quickly as we can.
You know,
And then, lots of re-injuries because it's probably going back too quickly and poorly rehabilitating it.
and you can get one of those agility ladders, and take it to your practices, or use that part of your warm-up where they're going in at angles, or going side to side, or going in with high knees, to work on the agility and what we call proprioception, which is your joint ability to tell your brain where you are in space.
Yeah, your positional sense.
Your positional sense. So you can work on that prior to the games, incorporate that into your warm-up if you have the time.
Yeah, but if you're tackled in an awkward way, your risk is high. So, yeah, we see a lot of ankle fractures and ankle sprains with soccer. Soccer and basketball are like our top two, lower extremity injuries, and then obviously baseball, shoulders and elbows, and then football, all of the above.
Thank you.
Mm-hmm.
All right, you guys can ask any question that is on your mind, anything that has not been covered, or anything you ever wanted to know. Go right ahead.
Hey guys, can you talk a little bit about what coaches should look out for as far as injuring themselves? Because sometimes coaches get involved in the activities, and we're a little bit older than the players, and we're susceptible to a different types of injuries.
Yeah, I have this on my list of things. It's going to be the same type of stuff, Tim. It's if you're standing around watching practice and then someone needs to sit out and you need to go in, probably not the wisest idea. But your flexibility has to be good. You got to work on some things with the kids when they're maybe doing some agility stuff early in practice. There are the adult leagues around here, and I'd say every year we get maybe 5 to 10 injured athletes. They pull a hammy or they strain a calf. Actually, we had one. He was probably 30 last year. He tore his ACL. And he decided not to have surgery. So that's classified as ACL deficient. So he's relying on all the other muscles in the lower leg to provide the stability that the ACL cannot. But yeah, I think even like, I did some coaching of basketball, my son and his buddies for a little while. And, you have 10 kids that are on the team, or 12 kids that are on the team, and all of a sudden 9 show up and they need another guy in there, and I would go out and play, and I'd be like, I'm just not ready, and it's my own fault because I didn't do the things that I needed to do to get ready. So all the stuff that we sort of presented in terms of agility, stretching, whether it be dynamic and static and strengthening, you need to sort of adhere to.
Hey, gentlemen, I have a question.
Mm-hmm.
I know we were talking a lot about rest and hydration. What should we be telling the kids? That I'm coaching a U12 group. How much should I be telling these guys to drink and stay hydrated, especially before and after a game, to help prevent? Because that's probably a lot of what your strains and your hamstring injuries are probably because of dehydration. What should we be recommending to them?
I still think water is the best thing, hydration wise. After a game, I think after a game, definitely water. So water or Gatorade works during to replace any of the salts that you're losing through the sweat. If you're thirsty, you're already dehydrated.
Yeah,
there is a number of.
Well, it used to be, you're supposed to drink 8 16-ounce glasses a day. All right. But more recently, I've heard you should be drinking, this is just on a regular day, up to half your body weight in ounces per day. So if you're 200 pounds, you should be chugging 100 ounces of water every day. Now in competition, like Ryan said, if you're thirsty, you're already behind. So they should, I would probably drink a liter of water before the game, as long as there's a bathroom close by. And then they should, whenever they get a break at halftime or what, they should probably try to drink, at least 12 ounces, 20 ounces of water during the game, and then immediately after the game start hydrating again. The nutrition part is a little tougher because kids can be a little finicky with what they like to eat, but just refueling the carbohydrates that are lost, those carbohydrates that are just floating around in the blood, ready to be used. But I would just think eating after the game is good. I mean, obviously it's a late game, you're not getting home till 11 o'clock, maybe not, but maybe on the way home your parents pack some snacks in the car. And obviously there's healthier choices and not so healthy choices.
I always did Taco Bell after soccer games.
Taco Bell after soccer games? That sounds good.
I don't recommend that anymore, but when I was 16, that seemed to work.
Worked well for me too. I'm not gonna lie.
Man.
Hi, this is Caleb. I just wanted to ask a quick question. I missed it earlier. I was a little bit late in case I missed an answer, but just wanted to ask, what would you say to convince recreational and travel coaches at the youth level to not spend their pregame warm-up doing nothing but touches and drills and actually do these aerobic and anaerobic exercises?
Yeah. So it all depends on how long you have for your warm up. You can I can't remember, maybe there's it's like 10 or 15 slides back. There's sort of a sample warm up that you can do with dynamic flexibility, and then also with doing like the high knees, the butt kicks, the karaoke, the side to sides. You want to, just like when you're doing your training programs, you want to work more than just in a front to back motion. A lot of lifts at the gym and a lot of warm-ups strictly incorporate you in the what's called the sagittal plane, which is you going front to back. But you need to work going at angles and side to side and rotational patterns. And
I also think you have to emphasize the importance of the agility and warm-up drills because it's injury prevention. Like my son played 7th and 8th grade soccer, and there's probably 15 or 20 kids on the team, and they're standing in a line waiting to take a pass kick from just outside the box. They're just standing there waiting. So that time I always thought was wasted. But I think you have to emphasize to the coaches that it is super important to get the muscles ready to participate. I don't think you're going to kick the ball any better in the 15 minutes before the game if you haven't worked on your kicking when you're supposed to work on your kicking. If you're going to get 2 or 3 touches or 2 or 3 kicks, I don't think that's going to really improve. But to prevent injury and losing players, I think that's how you have to approach it. You just have to tell them, the research is there, to get warmed up, to get some dynamic stretching in, to get the muscles, engorged with some blood, to get the fascia stretched out. That's how you have to sort of approach those coaches that maybe want to, get a lot of kicks or whatever.
And I forgot to mention this during, but I also think it's a good idea that when some kid comes off the field, that they just don't sit, that they stay moving. Like they don't have to do all the warm-up stuff again, but I do think if they're going to be off the field for 15, 20 minutes, that's...
Well, you see that in I don't know how much once you're out in soccer, you're out in soccer, and when you get up to the Premier League and what. But if you see like basketball players, NBA players, even college players, when they're taken out of the game, sometimes there's a bike over in their corner they're riding. You'll see that on the sidelines of the NFL. They'll have a bike that they're riding a little bit just to stay loose. So like Ryan says, just don't go sit on the bench. Move around a little bit, hydrate, and get ready to go back in.
Thanks, fellas.
Oh, you're welcome.
All right, last call on questions. Well, Dave and Ryan, thank you so very much for being with us tonight. I think that was a very interesting presentation, and I'm sure that coaches will be looking up the recording for those that had practices tonight. Again, if anybody has questions, we will be happy to forward them to Dave and Ryan. But for today, we will, unless Dave and Ryan, you have a closing word?
No, just if you do have any questions, I'd be happy to answer. You can look up our website. It's davidphysicaltherapy.com. Click on me. Now, our web system isn't the best. We're in the midst of changing something, but I do get to my emails when it works. It works most days, but sometimes I'm so busy in here that I don't get a chance to check them. So just to let you know, we are located in Mount Lebanon in the South Hills, and we're opening up a new office in South Point Town Center right on Main Street. So anybody that's down in the Cannon McMillan area or down there, we'll be happy to take care of you if you ever have any injuries, whether they be soccer or something else.
And hopefully there'll be much less now, much less injuries.
Yeah, well, let's hope.
Let's hope that indeed.
Yeah. So,
all right.
Yeah. Thank you.
Appreciate everybody.
So much.
Yeah. Thank you.
Thank you.
And that concludes our meeting for tonight. We continue on Thursday with Safe Sports. So stay safe until then. Good night, everybody. And thanks again for participating.
All right.
Thank you.
Thank you. Bye.
Thanks.